Hi, how are you? I am Fahad Nasser Al Sanad, Super Advisor for Special Education in the Department of Education in Riyadh City. Today we celebrate for the International Day for Disability People as a part of this country. We hope this celebration reflect to improve the service will be provided for these children, and we want to send a message for all the community. These people has a lot to do it for their country, and they has a different ability, so we have to improve their life and provide the service they need to give him a chance to work with us to improve this country.
And of course, sir, we thank you so much, Tom. Thank you so much for having us here. Wish you all the best.
Thank you so much.
Welcome back. So, well, first of all, we want to extend special thank you to Sultana Lubayt, who was covering the World Disability Day activities at the King Fahad Medical City for us, and doing this report through which we were able to have an insight on the event. Now, well, with us to talk more about World Disability Day and the awareness for this particular day, joining us here in the program is Dr. Sana'a Al-Madi. She is the head of physical therapy at the Rehab Hospital of King Fahad Medical City. Assalamu alaikum, Dr. Sana'a, and welcome to the program.
Thank you, it's my pleasure. And thank you for this opportunity to talk about one of the tackling issue in the Saudi society.
It's our pleasure that you came and joined us, Dr. Sana'a, today. So as we understand that the World Disability Day was the 3rd of December, and King Fahad Medical City held a special day for it in order to be able to create awareness.
Yeah, well, the International Day of Disability, as you said, it's celebrated every year on 3rd of December, and the day was promoted by the United Nations in 1992, and each year they have a special theme. They focus on a special theme, and this year the theme was Inclusion Matters. We at King Fahad Medical City, we celebrate the day every year. Since 2008, and the nice thing about the Disability Day is it raised the awareness about the disability, and also it gives the disabled person a chance to contribute and to integrate into the society.
Indeed, and Dr. Sana'a, unfortunately, disability individuals are increasing every year, especially in the Kingdom of Saudi Arabia, with different cases and different conditions. What are the most common cases of disability that you witnessed firsthand, especially in the Kingdom of Saudi Arabia, which is regarding hospitals, the type of patients or the cases that you see with disability?
Okay, first of all, when we talk about disability, we need to consider not only physical disability. Physical disability is a broad range of disability and a broad range of people. It covers physical disability, mental or intellectual disability, developmental disability, and psychosocial disability. Generally speaking, the latest statistic about disability in Saudi Arabia showed that more than 1.5 million people they are disabled, which is 8% of Saudi population. Actually, this rate is comparable to the international rate. The international rate is about 10%.
So we're somewhat lower than them, but unfortunately people are saying that it's slowly increasing year by year.
Yeah, it is increasing by year, and one of the most common cases of disability is spinal cord injury, which is causes by road traffic accident, and as you all know. Yeah.
And I believe that if you would look at the international statistics for disability, we'd be able to find that in a lot of the places in the world, the disabilities would be due to old age, due to medical conditions, and due to illnesses, whereas in Saudi Arabia, we are seeing a young population generally.
Yeah, it is, yeah. One of the most common cases are spinal cord injury, and most of them are young generation, and brain injury. Which are and they are also a young
Let me ask you, Dr. Sana'a, recently there was a lot of the news about special kind of warnings for the people who are driving, that they would be fined extra money if they are seen or caught using their mobile phone devices, drinking or eating while driving. Do you think that this is going to generally help the people?
Yeah, it will help the people to decrease the road traffic accident, and also it will lead to decrease the disability or spinal cord injury within the young generation.
Indeed, it's really, really great to see this particular initiative where they are saying the same thing about food and drinks while driving as well, because a lot of the times we get to see mobile phone use is of course a frequent complaint when driving, but it is seriously so worrisome when you are looking at the next person in the car and he's drinking from his beverage and taking a bite of his donut early in the morning. It's really, really something worrisome. But now with this, Dr. Sana'a, when we speak about disabilities here in Saudi Arabia, we get to see that the Kingdom of Saudi Arabia has done a lot of work in this regard in order to be able to integrate this population or this percentage of the persons with disability into different fields of life, into different jobs, and into many of the different areas when it comes to entertainment or being able to access facilities generally. And we saw a couple of years ago when there was a major drive to make all the government buildings accessible to the persons with disabilities, or to be able to make public areas accessible. Do you think this would help to integrate the people better in our society?
Absolutely true. If we have accessible environment and welcoming environment to the disabled people, of course they will integrate easily, and they will be more confident to show the other people their ability and their capability and their talent and their achievement.
Indeed, and of course, Dr. Sana'a, you know, there are many complications of disability. It's not like what you mentioned, there's only one type of disability, there's many, a broad, you know, a spectrum of disability. Can you tell us about what's the most complex case of disability, and what are the challenges or difficulties individuals or medical care experts like you are facing with this?
Okay, it's actually, there is the disability itself, it's a challenges.
Yes.
And the most complex cases with disability, the cases that has poor prognosis or a progressive nature. If we have a disease with a progressive nature or a disease with a poor prognosis, it's a challenging for us, for the disabled person, and for his family as well. These kind of cases, with the progressive nature, it's difficult to treat and manage with the rehabilitation. Our goals will be very limited toward these cases, and usually the goals for these cases, usually it's not to return to the full recovery like the other cases. Usually it will be towards the maintain or maintain their current status and prevent any complications.
Certainly. Now, Dr. Sana, when we speak about medical sciences here in Saudi Arabia, we get to see our facilities have evolved so much in the past decades, especially if you look at it when it comes to state-of-the-art, top-of-the-line cardiac care, to cancer care, to so much of research work that's being done here in Saudi Arabia. When we speak about rehabilitation and you being associated with the rehab hospital of King Fahd Medical City and being the head of the physical therapy unit, I would like to talk to you about rehabilitation facilities in Saudi Arabia, how they have evolved. Are we really having the top of the line facilities for the persons with disabilities, for the people who need to undergo rehabilitation for any reason?
Okay, talking about the rehabilitation in Saudi Arabia, I will talk about the King Fahd Medical City as an example. King Fahd Medical City considered to be the reference rehabilitation center in the kingdom, and at King Fahd Medical City we have a big rehab center with very good facilities. Our approach at King Fahd Medical City to look at the person as a whole person. It's a holistic approach. We look at the person as a whole person, not as his ability or his limitations. We consider the patient as a person who needs to recover and go back to his society and his previous illness. The rehab hospital at King Fahd Medical City has subspecialty within the rehab. Spinal cord injury, one of the subspecialty, traumatic brain injury, pediatric, and stroke as well. So those who are working with person with spinal cord injury are subspecialized with spinal cord injury, and this will give the person a chance to recover and to have the proper treatment and the good outcome as well.
Indeed, definitely, Dr. Sana'a. And for our dear viewers, take a quick and short report. Be joining you right after this for this very important discussion about Disability World Day, so stay tuned.